Hello, and welcome to another edition of Nice Living with Dr. Kamran. With me, as always, of course, the star of the show, Dr. Kamran Gourdarzi. Dr. Kamran, it's so great to be with you here again.
Wonderful to be here. Thank you.
Now, Dr. Kamran, you are just the pioneer in the industry when it comes to vein disease, venous insufficiency treatment. And I know it's been a huge passion of yours to not only educate patients about the signs and symptoms of vein disease, but also your colleagues in the field. And today's episode is dedicated to talking specifically to our friends that are primary care physicians. So tell us a little bit about what we have in store for our listeners today.
Again, thank you very much for having this participate in this dialogue. There are a lot of real pioneers who in the field. Of course, I think I've just contributed a very small amount, but I can say that we've been doing it for very many years, and specifically we have been concentrating on the non-invasive technique of taking care of veins as an office procedure for about since 2002, I believe. So it's been almost 22, 23 years. And of course, being exposed to this condition for this many years does show you some trends and educate us about things that we hadn't learned in medical school. So that was, I thought it was very important to, have this discussion so we can hopefully inform some of our primary care physicians about some of the symptoms that they might not think it is venous in origin.
Absolutely. And that's such an important topic, again, as we've primarily spoken with different patients about the condition. For primary care physicians, what are some of the misconceptions that you feel are most common among your colleagues there?
Well, thank you for asking this question. So the primary care physician, I think, got one of the toughest jobs because they have to know about every disease, about every condition. And every patient that walks in, their list of differential diagnoses is huge. What could it be? What's the most likely thing to be? One of the things that I've noticed, and I've finished medical school about 1978, well, actually finished medical school in London, University of London. Then I did 2 years of residency there, did another 5 years here. So I've been exposed to both countries and, a lot of internal medicine, general surgery, vascular surgery. One thing I noticed is the venous disease, unfortunately, and even I was taught this in medical school, that it was venous disease means varicose veins. And that is all we knew about it. So if the patient had varicose veins, then it was venous insufficiency, and we didn't have good ultrasounds. We didn't have ultrasounds in the beginning. Around 1978, it was still earlier stages. And as the resolution has gotten better, we are able to look under the skin. We're finding out there's a lot more going on than just having varicose veins. In fact, varicose veins may or may not be present when you have venous insufficiency. So a lot of patients that I see who are seen by family practitioners, primary care physicians, even in different specialties like orthopedics, neurosurgery, etc., etc. I noticed there's a lot of times the diagnosis was venous insufficiency and it was overlooked. So you and I talked about this before. So I thought, this would be an easy way of producing a podcast and sending it to primary care physicians. Hopefully, it's just, each episode is 20 minutes and it's free right now. So if they get on the car and driving or taking a break, they could have a listen and see, does it help them understand venous insufficiency? Is it important for them to know what venous insufficiency is? Is some of the conditions they're treating right now is venous insufficiency? They don't even know about it.
And so, Dr. Cameron, what are, some of these symptoms that patients may be coming in with that could be a red flag for venous insufficiency?
Well, again, so thank you for asking. That's very important because I think one of the number one misconceptions of patients come in and see me, and they've already seen the primary care physician, they've seen other doctors, is night cramps. They have cramps like Charlie horse, either in calf or I've seen it having in their thigh, even in their feet and their toes. And these are very classically at night for some unknown reason. And it gets to when it initially it's like once a month, then once a week, then every night, then it wakes them up. Then it wakes them up to go back to sleep. Then it wakes them up. It's so bad they have to get up and walk it off. And that
Mm.
is pretty much classic for venous insufficiency. I wasn't taught that in medical school. I had no idea that was, what was going on until I started treating these patients. And the first thing they told me after they've taken their veins is, "My God, my cramps are gone." So then, of course, the next question would be, "Well, had you complained this before?" "Well, yeah, I've seen my primary care physician, or I see my internist, I saw so and so, and they told me, well, I'm dehydrated." Well, as we know, you don't get dehydrated 2, 3 o'clock in the morning at night when you're sleeping. I mean, if you're dehydrated during the daytime, or you're low on magnesium, or you're low on potassium, or you're low on calcium, well, or it's very hard to get low on potassium unless you've got some medical condition causing it, or you're on a large amount of diuretics, or you don't get dehydrated unless you're in the middle of heat, or you've got severe diarrhea or nausea and vomiting. But an average person doesn't go to bed and all of a sudden gets dehydrated and gets cramps. So um, all we are doing is trying to give an explanation to the patient, so that's the end of that conversation. And I think it's very unfair there, because the patient is telling you, "I have venous insufficiency." And literally, by taking care of their veins, even so usually the commonest cause of venous insufficiency is great saphenous vein, and after that the small saphenous vein. So the minute we treat the great saphenous vein, I find out that the cramps are gone. I mean, it is amazing. It's like 2 + 2 is 4. You have cramps at night, it wakes them up, they have to walk it off. You treat the veins, cramps are gone. Now, there is one thing you could do, is put them on compression stocking. This is medical grade compression stocking, not any compression stocking that you can get. A lot of these compression stockings are doing more harm than good. These are thigh highs, because disease usually starts in the thigh, and they should be, one of the companies which has a FDA approval for proper compression stocking. We put that in only the daytime, never at night. Although they're wearing it during the daytime, they find that the cramps are so much better at night. And the minute you see some improvement, you're like, "Okay, I think I've got a diagnosis. This is probably what it is." Then, of course, you have an option of, continue to wear the stockings or have something done about it, which, most people, especially in the South, it gets so hot here, they would rather have something done. If it can be done safely and it could be done painlessly, they would rather have it done, and have those veins taken care of.
Are there any other symptoms that are pretty prominent for folks when they're going to their primary care physician?
Sure. So the other misdiagnosis, if I may use that word, and by the way, Amy, about depends what the studies you read, but anywhere from 35 to 45% of people, especially ladies, have venous insufficiency. So it's one of the commonest conditions on the face of the earth. When you think about what percent of people have gallstones, it's only 10%. What percent of patients have arthritis or fibromyalgia, um, or breast cancer? I say 1 in 10 person, 10 people can get breast cancer. Some say that's 1 in 10. 40% is almost half.
Mm.
So this is a condition that you're going to be very prone to it, and especially if one family member has it, uh, or certainly if two, it's almost 90% chance you're going to have venous deficiency. So extremely common condition, and there is a lot of breast cancer awareness, colon cancer awareness, heart disease awareness, but there's no such thing as venous insufficiency awareness, which is a condition which affects a lot of people and easily treated, and they don't know about it. So um, I noticed that cramps are missed very often when it comes to the symptoms. Now we're talking about symptoms, not signs yet. The runner-up there, although not quite as common, but it is missed a lot of times, is restless leg.
Mm.
These are people who tell me they're running the marathon, especially at night, or the husband tells me, or the wife tells me that my husband is running the marathon every night, just moving her legs constantly. Those people, when they come to see me, they have already seen neurologists, have seen primary care physicians. Sometimes they come in with 2, 3 different drugs, and some of these are anti-seizure medications, so they have to take it for life. And then it doesn't get better, then the primary care physician gives them another pill to add to it. So now they're on 2 pills, they're on 3 pills. And then it's very frustrating for the primary care physician as well. "Oh my God, what am I going to do with this person?" You send to a neurologist, they just give you the label, right? Restless leg. But what do I do with it? Take medication. And then they come in, we find out, if they've got venous insufficiency, have restless leg, you take care of the veins. In my opinion, in what I've seen in my practice, 70%, a minimum of 70% of these patients, The restless leg is either better or is cured.
Mm.
So, and they don't have to take medications, and the medicines are not safe. They're expensive. They can damage your liver. They can damage your kidney. They can affect your mind. Some of the seizure medications. So, if it is something that can cure you, why would you want to take medication? So, if you have restless leg and you have sign of venous insufficiency or family history, then I think those people are extremely thankful. And when you treat them, they restless leg gets better. So that's the number two symptoms.
Anything else that you see kind of as a recurring one that that folks are coming in the office asking about?
Well, this is a talk for a primary care physician, so I'm going to hit the number three, which would probably be number one, is swelling,
Mm.
swelling in their ankles. So the primary care physicians see patients, who have swelling. Well, could it be kidney function issues? Could it be heart failure? But very rarely they think about venous insufficiency. I mean, I have patients that come and see me, healthy 30-year-olds, and they said they have swelling, so the doctor gave them some Lasix and said, take this every time you get swelling. And of course, the swelling is there every day. As soon as they stop taking it, they get, more swelling, or stop the salt or whatever. In that age group, particularly, is venous insufficiency being the cause of the swelling is probably should be number one in the list of things you should think about. Considering that it's both legs, and if it's one leg, you always have to worry about deep vein thrombosis, which is very dangerous. So I'm not saying that that's a diagnosis. I've been in medicine, as I said, for close to 50 years. One lesson I learned: medicine is never just one thing; it's a series of things. And then you have to go through the list of differential diagnosis, come up with a list that all the probabilities, and then try to rule them out or rule them in, and then decide which one is easily treatable or not. Venous insufficiency, is very easily treatable. Lasix medication, you have to be on it for a long time. So once the primary care physician has done a thorough evaluation and knows that this is not their heart, this is not the kidney, I think you should say, okay, could this be venous insufficiency, and they could send them to a main physician who has a very good vascular ultrasound tape, because that's what it comes down to. Other techs, and I believe all the techs who deal with vein disease should have um, at least be certified in vascular ultrasound and have a fair amount of experience with venous disease, because it can fool you very easily. Um, so yeah, swelling is extremely important. So now you could have venous insufficiency and also have a little bit of salt retention. Address both conditions. They're not mutually exclusive. Take care of the vein and also give mild diuretic to take care of the swelling.
Yeah, and so the swelling aspect, that's also a visual sign there. But I imagine with the swelling, patients are encountering some of those symptoms like heavy, tired, maybe even achy legs with all that swelling. Is that something you experience too?
That's a very good point. Swellings are something kind of interesting, because sometimes patients, have sock lines and they don't think they have swelling. I've noticed if you got venous insufficiency when you're on a plane ride, because the cabin is not always pressurized. So they end up having, they say when I'm on a long flight, 4-hour flight, my ankles really swell up. That should make you very suspicious that it's venous insufficiency. So now you got all this fluid in your leg. What's that going to do? Your legs are going to be heavy. They're going to be tired. They're achy. Even puts more pressure on your knees, on your back. So if you have 10 pounds of weight per leg when you're trying to walk, it's going to put pressure on your knees, it's going to put pressure on your back. So you're going to tire easily. I mean, I've had patients with severe venous insufficiency that I've treated, and they say usually they used to have to put their hand behind their leg before they could put their leg out of the car. And now they can just lift their legs and get out of the car. They can go up and down the stairs easier. So um, the achy, tired feeling, unfortunately, we always try to find a reason what our symptoms are so you can forget about it. Oh, I walk on cement floors all day long. That's why my legs are swollen and achy. Well, honestly, don't think what the floor would be. Shouldn't make any difference. You have venous insufficiency. You see, the problem is, if I could describe venous insufficiency, and I try to understand it myself, how could I explain it? If somebody puts a tourniquet on your arm to draw your blood, we usually blow it about 40 millimeters of mercury, and that the artery, the blood is still getting to the arm, but the veins are blocked, so you can't get out. So then you draw the blood. Now, if somebody forgot to take that tourniquet off and send you home with it, as time goes by, your arm is going to get heavy, it's going to swell up, the fingers are going to be bluish in discoloration. So that is a anatomical blockage. Here is a valve issue, is a physiological blockage, because when you stand up, the valves don't work well in the superficial vein, so the blood, some of it tracks back down right through those superficial veins. So it's just like having a tourniquet in your arm. So when you have a tourniquet on the arm, I ask somebody, how does it feel like? Yeah, it's a little achy. It's a little bluish discoloration. It's just heavy. It aches. That's exactly what is happening to your legs when at the end of the day. So all these other symptoms obviously are going to get gotten better. I've had patients who really felt that they're never going to see an orthopod because their knee was hurting, and then when you really talk with them, find that really it was venous insufficiency. Take care of the veins, take care of the swelling. Their knees don't hurt as much. They're just, they can walk a lot better.
Does that impact any other aspects of the body overall? If the blood's pooling in the legs, is that impacting anything on the top half of the body?
Again, very, very good point. So if the blood is all pooling in your leg, it's not getting back to your heart. So I have patients, if you go on the Facebook, have some gigantic veins, usually guys especially. So a lot of these people in the warm day, they tell me they get lightheaded. They have to sit down. Why do they get lightheaded? Because those veins get bigger and bigger with heat. So now you have probably a pint or two of blood is pooling your leg, which means it's not going to go to your brain. So obviously the heart tries to compensate. It beats a little faster. It beats a little harder, called the Starling's curve, because it's like a pump. Not enough blood coming, except pump can't correct itself. Heart can. If you don't have enough blood coming back to your right atrium, it pumps harder, a little faster to get the blood going. Eventually, it gets to a point where you just can't keep up with it, and so they get lightheaded. The blood is not reaching to your brain, so then you have to sit down. So that is certainly a physiological problem. It is really does improve your circulation. A lot of these people that I take care of, you can see they get more hair on their ankles that I've seen, and that tells me there's improved circulation, because we all know poor circulation causes hair loss. So these are some of the symptoms, and of course we haven't even touched on the signs. If you could like to join us in the next episode, we can talk about the signs.
So stay tuned for the next episode of Nice Living with Dr. Cameron, where we'll continue this conversation all about vein disease signs, symptoms. We're going to dive into prevention as well and treatment options. So stay tuned. We'll see you next time on Nice Living with Dr. Cameron. Thanks so much.